It's been a long day, and so I will try and be bullet point brief. And the headlines, I'm going to go off script here to try and do that. The headlines here are that there is a robust science for many of the bills that are before you. I think some of them are relatively cosmetic but important, and some of them are strategic repositionings. I'm here to testify in favor of the Raise the Age legislation as one of those strategic repositionings, because I think it is a centerpiece for the opportunity of the Commonwealth to move forward in a very, very different way and to demonstrate its leadership. I will briefly recap. I'm currently the executive director at the Center for Law, Brain, and Behavior at Mass General Hospital. But over the course of my almost 40-year career, I've been in contact and working within the court system from the various early touch points of a child's life in the care and protection arena and juvenile justice. I was subsequently the statewide director of juvenile court clinic services, assistant commissioner for the Department of Mental Health, and the forensic examiner for the Massachusetts Parole Board. So I have seen this issue across the life cycle. What I'd like to say is, as far as Raise the Age, the science is very, very clear. It's not a complicated policy question from the perspective of the evidence. We know that handling young people as juveniles who need developmentally aligned accountability but need positive youth supports simply gets us better public safety outcomes. And if we can agree that we all in this room, of whatever our perspectives, would support the well-being of all Massachusetts citizens, including our children, but also the safety of the communities in which they live, this one is a no-brainer. There's an age curve that corrects, that culminates at about 15, 16, 17, and then begins to drop into the early 20s. If you were going to build a system to compromise adolescent development and young adult development, you would draw the line at age 18, and you would support them until they're 18, and then you would be massively harsh with them once they turned 18, and you would predictably get what the evidence would tell you, which is increased rates of recidivism and deepening criminal activity. Pragmatically, I appreciate that this is a complicated issue and would require a redeployment of resources, and quite frankly, having been inside these systems for 40 years, a culture change for the way we do business. Finally, I would just like to say on the treatment not incarceration bill that there is good science for the elements behind it, including most importantly, that coercion alone does not address addiction. It requires engagement and evidence-based care in the way that that bill is intended to do. And finally, as I'm out of time, I just can't help but point out on the joint venture and felony murder issue, the culture that gave us that legal doctrine repealed it in its entirety in 1957. The UK has not had a felony murder joint venture doctrine for decades, and their civilization has not yet collapsed.
Thank you. Thank you, Doctor.